Ms Richards.
Yes, sir. So I mentioned on Monday that we had directed some questions to those responsible for decisions about NHS services in the 4 parts of the United Kingdom. And I'm just going to summarise and read shortly from some of the responses that were received. So we asked a slightly wider range of questions than I'm going to deal with now. The first category of questions I'm going to deal with are about hepatitis C, and we asked 2 questions that I'm going to describe. What scans, blood tests and/or other checks and/or monitoring are or should be offered to a person who's been diagnosed with hepatitis C? How often and over what period of time? Was the first question we asked. And the second, following successful treatment such that the person has received a sustained virological response, what follow-up scans, blood tests and/or other checks and/or monitoring are or should be offered, how often and over what period of time? So we asked about those, the current clinical practice or what should be the current clinical practice and availability of care in that regard. And I'm just going to read briefly what the 4 responses were from the 4 parts of the United Kingdom, because we know from the individual evidence we've heard that on the ground people have not had necessarily a consistent answer from their own treating hospitals and trusts. So the response in relation to Scotland, we had several witness statements from Scotland. These will be published on the inquiry website, hopefully later today, if not early next week. On this particular issue, in fact, the Scottish Government asked Professor Dillon, who you heard from as part of the evidence this week, to provide a response. And the response was this. So in response to the question about scans, blood tests and other checks, he said this: these have changed and continue to change radically and are continually updated in national and international guidelines as new evidence emerges. In summary, a person diagnosed with hepatitis C should have either bloods, liver function tests and full blood count to calculate an FIB4 score or other estimate of fibrosis, or an imaging-based assessment, e.g. FibroScan, to stage their disease. Those who don't have evidence of cirrhosis may be treated, and a blood test obtained at 12 or 24 weeks post-treatment to confirm success and then discharged. Those with evidence of cirrhosis should be treated and remain under 6-monthly review to screen for complications of cirrhosis, in particular hepatocellular carcinoma, with 6-monthly hepatic ultrasounds and estimations of alpha-fetoprotein, and gastrointestinal varices, 3-yearly upper gastrointestinal endoscopy. And then, in response to the question about checks and monitoring following SVR, he effectively already answered, but he said this. Again, this area has changed considerably due to the development of the evidence base, especially around the confidence that SVR is a marker of HCV cure. Thus, the need for long-term follow-up has been removed for most patients. As described above, follow-up depends on the degree of liver damage, those with cirrhosis needing follow-up. And of course, we had a slight amplification of that in the course of his evidence this week. The position in relation to Wales is set out in a statement from Professor Chris Jones, the Deputy Chief Medical Officer, and he said this: it depends somewhat on the patient's circumstances and choice. In general, where possible, the following pathway is followed: baseline blood tests, including urea and electrolytes, liver function tests, estimated glomerular filtration rate, international normalised ration, full blood count, viral load, genotype and FibroScan performed in a one-stop clinic. Review patient with results, 2 to 4 weeks for results, and medication ordered according to results. Treatment commenced 2 weeks later, delivery time 2 weeks. Review patient early in course of treatment, 2 to 3 weeks after starting, to check patient is tolerating treatment, compliance, repeat routine bloods. Further follow-up at the discretion of the treating clinician in partnership with the patient. Review patient 12 weeks after treatment is finished for blood tests to confirm success of treatment. And then in relation to subsequent follow-up post-SVR, he said this: this depends on the patient's level of disease prior to treatment. If the patient has no or minimal damage to the liver prior to treatment, then the patient is discharged back into the community as no follow-up is required. If the patient has advanced liver disease, then they would be followed up appropriately by that service, i.e. regular scans for hepatocellular carcinoma and regular monitoring with hepatology. Further later date blood-borne virus testing is also recommended if a patient continues to engage in injecting drug use, so that last bit's not material for present purposes. So that was the position in relation to Wales. insofar as Northern Ireland is concerned, we have a statement from the Director of Surgery and Specialist Services at Belfast Health and Social Care Trust, Caroline Leonard, and what she has said is this. The hepatology team in Belfast Trust advised that all new patients with a diagnosis of HCV are offered blood tests, and she's listed the various tests, an ultrasound scan and a fibroscan. Those who have chronic hepatitis C and who are fit for treatment are offered treatment if treatment is commenced. Blood tests are carried out during treatment to ensure liver tests remain satisfactory. At the end of treatment, hepatitis C status is checked with HCV PCR test, and again 3 months after completion of treatment. If the PCR test is negative at end of treatment and 3 months post-treatment, this indicates successful clearance of the HCV infection. In previous years, it was also the practice of the regional hepatology team at the Royal Victoria Hospital to do a check-up PCR test 1 year post-treatment. In keeping with practice throughout the UK, this is no longer required. And then in terms of follow-up post-SVR, she says this. The hepatology team in Belfast Trust advised that patients who are PCR negative after treatment and who have a normal fibroscan are discharged from the hepatology clinic. Those who have an indeterminate fibroscan result will usually have a follow-up fibroscan at least 6 months after finishing treatment. If the fibroscan is satisfactory, the patients are discharged. Patients who have a fibroscan suggestive of advanced fibrosis or cirrhosis are kept under long-term review at the liver clinic. These patients require an ultrasound and blood test for alpha-fetoprotein every 6 months to screen for hepatocellular cancer. In addition, such patients have a 6-monthly clinic review. And then to complete the geographical picture, in relation to England, we have a statement of Claire Foreman on behalf of NHS England. And she says, her statement is rather lengthier, and so I'm not going to read out all of it. She refers to what would be the ordinary pattern of HCV care. And then on the issue of what happens post-SVR, she says this. It's generally recommended that in the absence of liver cirrhosis, patients with HCV who have cleared the virus with treatment can be discharged from follow-up and no routine surveillance is indicated. Many clinicians perform a single repeat check of HCV RNA status and liver function 6 to 12 months after treatment to identify the very rare patients who suffer a late relapse. But in the absence of comorbidities, no follow-up is indicated. For patients with cirrhosis, standard follow-up post-therapy should include a review every 6 months with an assessment of liver function by blood tests, including a full blood count, liver function tests and usually clotting assessment. A liver cancer screen should be performed with an ultrasound scan and an alpha-fetoprotein assessment. And then there's a reference to differential follow-up depending upon comorbidities. So the purpose of highlighting those statements and drawing attention to the fact that they'll be published upon the inquiry's website is precisely because we have heard people relaying that they have not been receiving follow-up care. And whilst obviously the inquiry is not in a position to investigate such individual cases, it's hoped that by asking the question of the 4 nations or parts of the United Kingdom and getting these answers, individuals who feel they have not been receiving the follow-up care that they are maybe entitled to can use this information to go to their treating clinicians or to their GP and ask to have fibroscans, blood tests and the appropriate referrals.